Okay, today's April 4, 2013. We're here with Maria. Maria is a Mexican-born woman who's totally American now, who 3 years ago, or 2.5 years ago, out of the blue, developed rheumatoid arthritis. And I'm going to give a quick history, and if I don't get this absolutely right, you can interject, okay?
Okay.
Out of the blue, you got, let's see your hands. The viewer can see that very clearly, that she's got enlargement of these joints right here, and also the distal joints. You can see it in the thumb, and even her wrist. There's swelling in her wrist, and it's mainly affecting her hands and her feet. Now, this hit you out of the blue, and you noticed morning swelling and stiffness.
Correct.
And you saw a doctor, they did a good workup on you, and they found all the chemical characteristics of rheumatoid arthritis, correct?
Yes.
And I can also show the viewer on an x-ray right here that there's some bony erosion right there, meaning that your rheumatoid arthritis is continuing and advancing and causing bone destruction. They gave you initially methotrexate and a synthetic steroid and one other drug, and you did well for a couple months, and now you're just down to methotrexate.
Right.
And they've been increasing the dose, and you're getting worse. And now they're talking about giving you Remicade, correct?
Right. Well, it was Enbrel first.
Or
but
Enbrel.
My insurance didn't pay for it, so he said, well, then it's Remicade because
Yes.
you need something.
It's rather expensive, and they've probably warned you about the toxicity.
Yeah.
Okay, and you've come to me looking for an alternative, correct?
Correct.
Okay. Now, I've done nothing with you yet except take history.
Correct.
And so far on this history, we've determined that you had wisdom tooth extracted.
Correct.
And I happen to I look in people's mouths. That's what I do. Bend your head back, open wide, and you can see very significantly an area of discoloration up above what looks like a filling. And I'll put some light on that. So we're going to put some light on that, and you can see it. There we go. That shines out now, actually. One other thing we want to note is that she has a scar here that's got a little bit of small keloid formation right in this area. She had a lipoma removed. Now, both of these things happened before the rheumatoid arthritis hit, right?
Oh, yeah.
Okay, and we have no other explanation for this. The doctors say it's in your genes, but there's no family history of it in a direct line, correct?
No.
Okay,
Correct.
so we're going to see if we can find more things that could be caused. I mean, right now we found these couple things that could be problematic, and there could also be a potential for food allergies too. So we're going to get more into this.
Okay.
Okay, we got the video going again. Maria, we just did a couple things, only two significant things, right? We gave an injection to the scar that was on your right side,
That's right.
on the back, just under the bra line. And then I gave you an injection up to where tooth number 16, or wisdom tooth 16 would have been. I put some Procaine in there. Can you tell the viewer what happened to you?
My pain levels diminished. I mean, it decreased significantly from about 5 to 6 pain
Yes.
to about 1 right now. That I can move my hands, and earlier the last few days it's been bothering me a lot. The inflammation. It was hard for me to bend this finger without having a lot of pain.
And now?
And right now, I have a little bit of pain, discomfort.
But movement is,
But I can't say it's it's awful for me to do it. It's
did this,
manageable.
did this come as a surprise to you?
Yeah, think I'm going crazy. You're playing with my head, Dr.
There's a lot of people who think that. That's why I have to
Yeah.
video this for people to
like-
believe it. That's exactly why I do it. May I post this on YouTube?
Sure.
Thank you. All right. Let me explain to you what happened, and we'll keep it on the video too. I'm always suspicious that there could be a hidden infection in the body. It's been known for decades, back into the last century, based on the work of a very famous dentist called Weston Price, and he dealt with diet as well, but he was into dentistry too, that infections in teeth and in the bones around teeth can seed the body and cause autoimmune disease. So I am very interested in root canals or teeth that have been pulled, or any possibility of infection in the jaw. And you had 4 wisdom teeth pulled, and they were pulled not long, actually 5 wisdom teeth, because you told me you had
I
supernumerary
did.
wisdom teeth, which I have never experienced. And one is still left somewhere.
Right.
Do you know where it's left?
The doctor said it was too close to my sinus,
Okay,
so it would involve a different.
understood. Which side, do you know?
I don't know.
You don't know, okay. Well, so I was suspicious of that because that occurred before the arthritis started, and I was suspicious of any surgeries like that lipoma removal, because that can cause a disturbance in your energy field, your energy flow. It affects the autonomic nervous system. I'd be more suspicious of a problem in the jaw, though, than even a scar, because you're dealing with inflammation there, which in my opinion is infection or allergy. It's not a deficiency of methotrexate or Remicade. You with me on that? I don't believe you were born with a deficiency of an immunosuppressive drug like methotrexate, which is used for cancer. And I don't believe you were born with a deficiency of something like Remicade, which forcibly alters your immune system. Yes, there's places for these things, but let's look for causes first. So we injected your lipoma scar, and we injected number 16. You got an instant, significant reduction in pain. And sometimes we get a wipeout of pain altogether. Now, in your case, I wouldn't expect to see a total dissolution of the problem, especially if there's infection, because there's active inflammation going on there, not just referred pain. Additionally, we looked in your mouth and we saw a lesion on the inside of your palate that you've noticed for a long
I've known this
time,
for a while, and it's like, I wonder what that is.
and no one's paid any attention to
Well, I
that.
haven't been. I mean, I'm not due for my cleaning yet. I was there.
I understand.
You know what I mean? And so I just.
And I'm not a dentist and I don't know what that is, but I'm going to tell you it could very well be connected with what's going on with you. And we need to look at that. So,
Okay.
before I go any further with you, I'm going to be sending you to a dentist who's going to take a very careful look at number 16 and also that lesion on the inside of your palate to see if we can find a common denominator.
Okay.
That doesn't mean we don't have to do oxidation. Oxidation definitely will help and support you, in my opinion. We even have a book on it right here that's called The Applications of Ozone Therapy in Pain Management, Rheumatic and Orthopedic Diseases. And this is written by a European physician, researcher, who uses oxidation for rheumatoid arthritis and puts most of his patients into remission or near remission using oxidation therapy. So these are the things I would like to go at you with first before I do anything else with you. Are you okay
Yeah.
with that?
I'm good with that.
Okay.